My name is Dr. Deborah Kioy, a pharmacist, a researcher, a trainer, a promoter of product development, regulator, quality assurance expert. Also worked in stewardship, promoting mapping of disease and research needs. I did my undergraduate studies in the University of Nairobi. I was in the first class. I graduated in 1978.
Oh, the one commissioned by the president, the very first class.
Yes, the very first class. A very interesting class. And I enjoyed myself being in that class. It is always good to be a pioneer because you are not following any other norms. You are giving it the best you have. And that is what our class did. Our class was actually more like a homeless group of students. And we did our best. And we have moved far with the training that we got. And we had very good trainers. Yes. It was a lot of fun, but also a lot of challenges. We were like homeless students because we didn't have a place that we called our own. In the first 2 years, we moved from one class to another with other students. What happened is that we would go to class with medical students, we would go to class with BSc students, we would go to class with veterinary students or be taught by veterinary lecturers, biological sciences lecturers. We moved all over the place. And in every class, we fitted and excelled. And we were very proud that we were able to fit in all these different classes and also excelled. And it was a very good class of students. Yes. I have worked in very many pharmacy sectors. After graduation, usually you go for internship, where you work in a retail pharmacy. You also work in a pharmaceutical industry, and also work in a hospital. During my internship, I worked in one of the pharmacies in town. It was Mansion Pharmacy. And I did my 3 months there. Then I went to the industry. I worked with a company called Glaxo, and I worked for 3 months. And I came back to the hospital and worked in Kenyatta for another 3 months. Yes. After that, I was posted to Kenyatta for just temporarily, and almost immediately I was posted to the Ministry of Health to be a deputy pharmacist, but also a pharmacist in charge of drug registration. So drug registration is mainly about regulatory. At that time, we didn't have drug registration in the country. And when I was approached by the chief pharmacist then to go to the ministry to help him to do drug registration, I didn't know what it was. He actually asked me, he had come to me specifically to go and do either one of the two things, drug registration or quality control. And I knew from my studies what quality control was, but I didn't know what drug registration was because there was none in the country. Therefore, I asked, what is drug registration? And he said, well, it's about registering drugs. We don't have it in the country, so I want us to start it. And I clearly felt like I wanted to be another pioneer
Sure.
in another area of drug registration.
Yeah.
And that is what I chose to do. And I went to the Ministry of Health, where I worked to develop the process of drug registration, of course, together with the chief pharmacist and the board, Pharmacy and Poisons Board. And that was in 1980. In 1981, we had already come up with the drug registration rules and regulations
For sure.
and guidelines.
Yeah.
And it was published in 1981.
Okay.
And by 1982, we implemented drug registration.
Okay.
We started drug registration in the country. So that is an area that I felt I did something.
Yeah.
Then after that, I was posted to Kenyatta Hospital to be the pharmacist in charge of the National Hospital. And I didn't stay there long. I stayed for a few months. And then I moved to Kenya Medical Research Institute.
Okay.
When I moved to Kenya Medical Research Institute, I joined the Center of Traditional Medicines and Drugs.
Okay. With Professor Jennifer Oro.
Yes. And I worked there for a long time, 11 years. During that time, we were able to map a number of plants that are medicinal, and our job was mainly interviewing the traditional doctors, moving around to find out what they do, how do they prepare their medicines, and how do they administer the medicines. Our aim was to be able to mimic what they do and put science in it,
Yeah.
to try and see if we can now prepare same preparations and give people. Of course, make them pharmaceutical
Yeah.
that are acceptable. While there, I was also, I had an opportunity to go and do my PhD. And I went to, before I went to Cambridge, when I was in the ministry, I was exposed to a diploma in pharmaceutical development technology in Belgium for about 6 months. That is when it was mainly to do with what I was doing in drug registration and control of drugs. But when I joined the research environment, I was able to go to do a PhD. During this time, since I was already in traditional medicines and herbs and plants and all that, I picked a plant that I was interested in. From all the interviews we were doing with the traditional doctors, I picked a plant which I worked on for my PhD, which is called Wabagia ugandensis. And I did my PhD. In 3 years, I was able to come back. During my PhD, I was able to demonstrate that this plant actually works in the laboratory. Of course, I isolated compounds that I could show activity on mainly protozoas, that it actually kills the protozoas. So it was in that process that I developed even more interest in product development. When I came back, I started working on the same, trying to see how we can develop these products from Wabagia ugandensis, but we didn't go very far. Eventually, I had to leave Cambridge and join the University of Nairobi, where I trained I joined as a lecturer. I was teaching pharmacy students, and then, was promoted to senior lecturer. But around the same time, I got another job in an international organization with World Health Organization, where I was given a position of which was very related to my interest of product development, I was the preclinical coordinator, which means clinical development is a part of developing the products. Towards the end, I'll show you the pipeline.
For sure, for sure.
So in 1998, I left to join WHO, and
1998.
98.
Okay, okay.
That is when I left the university
Yeah.
to go and join WHO, and I was posted in Geneva, and I was working there mainly as a preclinical coordinator. In WHO, I was working with the program for research and training in tropical diseases.
Yeah.
That was my department. What that means is we were mainly interested in promoting capacity for developing countries who have the tropical diseases, you know. So when we looked at my area of work was to help them to undertake preclinical development, because I was a preclinical coordinator. And to do that, we started by developing standards, quality practices that they would use to be able to reach that stage of identifying a product that can now be taken to clinical trials, okay, according to the standards, the normal practices. So I started by developing documents like good laboratory practices. This is one of the documents to train, and then the training material to train scientists, especially in developing countries, to be able to move whatever products they have. Remember, I said I was in a laboratory, my PhD, and I got some products, but I had not moved them to preclinical development, so that now you are able to say, now this product at this concentration, it can work for this and this product, so that now you can move it to clinical trials. So I was put in a position where now I can help scientists in the developing countries to move their products from just a product that may work to a product that is proven that works.
Yeah.
So I started by training them to do that work according to good practices, which means it will be accepted anywhere, okay? And anybody can repeat it and get the same results. So we were training mainly in the Latin Americas, in Africa, places like India, you know, all along Thailand, the whole of, you know, tropical countries that normally have tropical diseases. So we did that for quite a while. So, and that is the time that we developed the documents for them, the hard books, we used to call them hard books, how to conduct non-clinical safety testing, and how to use quality standards so that you, whatever results you have are not questionable. They are actually good results and can be used by anybody to develop drugs. And the next thing was to now these drugs can also be taken to clinics to be tested for clinical trials. So I worked there for a long time. During that time, I was also responsible for managing some clinical trials, whereby we have products that have already passed through non-clinical development and are now being taken to clinical trials in collaboration with other countries. And we had like clinical trial centers in places like Uganda, Zambia. Unfortunately, I didn't have any in Kenya, but we had some that we were testing in Uganda for trypanosomiasis. We had others that we were trying in Zambia for malaria. So those are the kind of things I did. And then after a while, we didn't have enough funding for to develop products. So what we did was now we started doing stewardship. We did stewardship in a way that we would take a disease, map everything about the disease, all the known information, and then look at what are the research needs. And we developed documents like, we can look at this one. We had 3 of them, like research priorities for helminth infections, research priorities for zoonotic and marginalized infections, research priorities for Chagas disease, human African trypanosomiasis, and leishmania, and research priorities for environment, agriculture, and infectious diseases of poverty. We have started moving to diseases of poverty rather than just tropical diseases, because we were feeling that there were some diseases that were really marginalized as poverty diseases, or diseases that affect the very poor. So we had started now moving more into stewardship than just focusing on product development. And it is at that point that I retired as a worker. Mainly is in the regulatory, especially with drug registration, which we started 45 years ago, and it is still operational up to today, and it works. So that nationally, I would say that is one job or one activity that I feel I would say it was a position of influence and still has impact up to today. In the area of quality practices and non-clinical development, it is also an area that I think impacted very much on the countries, mainly countries south of the Sahara, the tropical countries, all over the continents of Latin America, Africa, Asia, and we developed a system that is self-sustaining, where we trained as early as 2001, we trained quality practices, and we also trained trainers, so that in every country we left trainers who can propagate the quality practices. So by 2003, we had enough trainers for each continent, such that if we are talking about Latin America, we knew which were the trainers, whether they are in Brazil or Colombia or Guatemala or wherever. We had people we can call upon to organize for trainings. And also the same with Asia countries. The most interesting thing is, as we developed these documents, we thought we were developing them for only the developing countries, but we found that when we put them up, when we developed them, we had requests from people all over the world, people from America asking us whether they can make our documents a set book for their trainings. And of course, as an international organization, UN, we don't sell books, so we just used to tell them you can pull them from the internet with the under this. So we know we had an impact not only in the developing countries, but all over. Then also in terms of stewardship, where we were mapping the prevalence of diseases and identifying research priorities. Also, that is an area that has an impact, because we developed documents which we normally, as I have shown you, we call them technical reports, WHO technical report series, which are now available in the internet, which can be used by anybody who wants to look at, let's say, a certain disease and find out what was known and what is still not known. Obviously, these books are now like 10 years old, and they may require some further updates depending on what work has been done, but it gives you a basis of where to start, especially if you are a researcher. You can go there and find out what was known at that time and what more do I need to find out? It's a very good book for a researcher who wants to move into a certain area, especially the ones that we have worked on. Of course, alongside other technical report series from the WHO. So I feel like those ones are the main areas that I would say have had influence in my career. I would say pharmacy training is a very good training. The training we had made the pharmacist stick out as that person who could work anywhere. And actually, a pharmacist can do almost anything related to the health of a person. And the training, I trained there, and then almost after 20 years, because I finished in 78, and I joined them back to train in 96. I think we still have up to now a good training that makes a pharmacist stick out as a scientist and somebody who can handle anything. Our training, pharmacy training, is very rigorous. So a training of pharmacy makes a pharmacist that person who can do almost anything. They fit everywhere in terms of whether it's in research, whether it's in policy, and even in the mainstream, pharmacy, like dispensing and doing. The only challenge is if somebody is practicing pharmacy, because as I have explained, I didn't practice pharmacy when I was out of the country. I was at another level of policy and capacity strengthening. The only challenge is wherever you go to practice pharmacy, you would need to comply with the regulations of those countries. But from my experience, I didn't find anything that would be called a challenge as such, because as a pharmacist, I felt like I knew most of the things, and I could adapt and learn from whatever experience you are being challenged to. Yeah.
Thank you so much. You were telling us the threats, challenges, and opportunities that pharmacists working abroad may face.
Yes.
And you've completed that correctly. I was just wondering whether you could expound a bit more on the opportunities side of things.
Opportunities.
Yes.
Opportunities are many. What I believe is that if you are a pharmacist, you should have an open mind.
Yeah.
Your mind should not limit you to a certain level. You should be open to move out and do, because, like I said, pharmacists are trained in a way that they can do anything. I've just explained to you that when I was told to go and be in charge of drug registration, I didn't know what drug registration was. And I still went, and it worked so well. When I got this job in WHO, they said non-clinical development, GLP. I didn't know what it was, but I took it up, and it was very interesting. I was the pioneer in that area, of drug development. They had not done it before, and it worked so well. I think the challenge I would give the pharmacist is not to fear to move into new areas, because with the kind of training they have, they can do almost anything that is possible that can be done. So it's the self-confidence that you can do it, and you move on and do it. So I think the opportunities are very, very many, and they should not limit themselves. When they see a job being advertised, or they can even try to solicit jobs to do anything that they feel like they would like to do. I am sure a pharmacist would be able to to work anywhere.
For sure.
Yes.
For sure.
Yes.
Actually, interviewing the various stakeholders and parts of the alumni, I've realized pharmacists work from A to Z. They work in all sectors, all over, not in the country only, but internationally too.
Yes.
Even you being a perfect example of that.
Yes.
Yeah.
I was trained 50 years ago, and there are new changes, new developments, new knowledge that has come up.
Yeah.
At the moment, all I would say is that they need to keep up with the new developments, with the new changes, and which I think they are doing at the moment. But otherwise, the training is good, it's basic, and it works. Yes.
It was adequate enough.
Yes, yes. I was there, but not really there as in the training itself. But what has happened is that before, when you had to go to the library to do everything you needed was to look for a book, and these days, of course, with the internet and everything, it's easier to do your research and to get what you want.
Yeah.
And of course, it doesn't take away the interest and the fact that you have to work hard, okay? The fact is you even should do better, because it's easier to get the information, So I think that technology has made it easier for people to reach the right information, and also to be exposed to what is happening and also the changes that are coming up. Yes. Yeah, and therefore they can now have even more areas that they can, diversify to. Yeah. There are some aspects of pharmacy that makes the pharmacist a better person to interact with the community, which the pharmacists are getting from the training as pharmacists. Of course, some you have to get as you interact, as you continue. But the training makes this pharmacist a very rounded person, okay? But when you get out into the market, depending on which area you get to, you also need an environment that makes you work well. Sometimes there is a hindrance as to what can you do. You are kind of limited. But the training per se brings out a person who can support and who can work for the community and give the best service. Yes.
Thank you so much. So I also think this question touches on what you mentioned before, how you help tropical countries and
Yes.
developing countries.
Yes.
Maybe you could mention something a bit on that.
About making, okay,
The impact.
the impact.
Research, for example.
Oh, okay. Okay. The impact of my work. I thought you were talking about training in general.
Even now, your practice.
My practice. In my practice, I feel that if I'm not repeating myself, I've impacted in the fact that there was no a register of drugs when we qualified. But when we started drug registration, now it's possible to go to look at the register and know which drugs are allowed in the market. I'd just written something a little about the drug registration. So we know now what is, we have a regulated system. We know what drugs are in the market through starting drug registration and processes of registering drugs. In traditional medicines and research that I was engaged in Kemri, we also had a list. We prepared a register of plants that are used by our traditional people, and we used to have even a list of what diseases do they treat and how do they prepare, because we were planning to go into product development, which eventually I happened to get into, but at a different position. In my different position, I helped developing countries to move to product development through non-clinical development, where they can move their products to non-clinical development, proving that they have activity and using good practices, good laboratory practices. Also, when I finished with that area of good laboratory practice, I went back to even an area scientist who is isolating compounds and they don't know what to do, or they have not moved to clinical trials. And we produced another document which we call Quality Practices in Basic Biomedical Research. That is somebody who is producing a product, okay? But you want to be able to publish that, and if somebody else comes and uses the method you used, will get exactly the same product. And that is why my impact, I think, is mainly in quality practices and regulations. The other one is in stewardship, trying to figure out what are the issues with this disease, what are the areas that are known, what is the unknown, and what are the priority areas for research. Those are some of the impact that I think, the influence, I would say, through my research or my work experience. I think nationally, I would say I contributed in my practices as working in research in Kemri, working in the Ministry of Health, training in the University of Nairobi. I would say that is national input. At the same time, when working in Kemri or even in Kenya, we used to collaborate a lot with African countries. And we would have symposiums and seminars and trainings together. But internationally, of course, I have just explained that when I was working with the TDR, Program for Research and Training in Tropical Diseases, we worked in different continents internationally, and also in Africa, where I was in charge of some clinical trials, not necessarily in Kenya, but in other African countries. And my training on good laboratory practices impacted nationally, regionally, and also internationally. Yes, and also now the stewardship, the priority for research is worldwide, because you find even people in Europe, in America, in wherever, if they want to do research in a certain area, they will use this as a reference. I would still like them to remember about my 3 areas.
Yeah, for sure.
Which is regulation, drug regulation, quality practices in product development. And before we finish, I'll show you a map of how product development is supposed to look like. And also in stewardship, in mapping the needs or priorities for research. Yeah, so when you map the priority areas for research, you are saying we don't know enough in this area, we don't know enough in this area, so that you give a challenge to somebody who, another researcher who wants to come and do some research. So that is also an area that I would like people to remember me for. My vision for pharmacy, both training and practice in the next 50 years would be such that we have pharmacists involved in healthcare in such a way that they are using the locally available materials and products to produce drugs, stroke remedies for the diseases that we have. I would like to see product development really happening in Kenya, not just from chemicals, but from our traditional products that we have, such that we can produce our own drugs that suit ourselves. My vision for a pharmacist is that they would be involved in the areas that promote health, which would include food, you know, herbal medicines, and all the way to, you know, being involved to monitor the nutrition and understand what type of foods, how they are grown, and how they can recommend the right diets for people. Because today, the world is realizing that they need to go back to the basics, okay? So I would urge the pharmacists of today to look into those areas. How can they help our people? How can they add value to what we know traditional doctors are doing? How can they add scientific knowledge in it to make it more acceptable, to develop it, you know, from product, from that medicine, go through non-clinical, clinical in a different way, and put it in the pharmacies. I would like to see these products being in our pharmacy today, being prescribed by pharmacists, and for people coming and being given these products that are made from our local environments. Our indigenous knowledge is rich, but it is being eroded. It is disappearing. I wish that we would have more pharmacists thinking of alternative medicine, alternative traditional remedies, and develop products to that effect to help people. I am an advocate for properly researched products. As I have said, I'm a researcher to prove efficacy and safety for these products. What we have today, I know people still go to take them, and some take them. But how can we bring it to another level where people will really depend on them and they know they're taking a good thing? Yeah. I would like to congratulate all the pharmacists. Like I said, I have a lot of faith in pharmacy as a training and even as a practice. I think they do a good job. They have tried their best, but we still have areas that we need to work on. In the next 50 years, like I have just said, I would like to see a pharmacist who is in control of all the products that are being given to the communities, okay? Because you see, a pharmacist is associated with giving something to take. So they would be able to be in charge of whether the remedies are traditional or the conventional drugs. They would be able to know how to help the patient or the community, and also engage into, like I just said, health in general, well-being, health, well-being of people. Just people being healthy and avoiding use of drugs. And that is why I mentioned food, and all these supplements. How can they help? How can they add value in them so that they can help our communities? Yes.
Yeah. Thank you so much, Daktari. That I believe is it. Asante sana for taking your time to be with us and have this interview. Your input is appreciated. Sana, sana,
Yeah.
sana.
Yeah, I guess I didn't say that I congratulate the people who have organized this one, the alumni that is organizing this 50 years, Pharmacy at 50.
For sure.
I congratulate all of them, and they're doing a good work. It's really something worth looking at, so that you can know where you're coming from as you think of where you want to go.
For sure.
Yes, I congratulate all of them. Yes.
Asante sana.
You're welcome.
Thank you so much.